For our clinical teaching project, we did it on pressure ulcers. Group members included Riley Hanger, Jennifer Payne, Julia Nail, Rachel Dorsky, Kayla Hunter, and Julia Bregermeyer.
Hi, it's Riley Hanger.
Hi, it's Jennifer Payne.
All right, we're going to talk about our articles. Let me just pull them up really quick. All right, Jenny.
Alright, so this first article discusses common body parts that are at risk for pressure injury. It also describes different ways to care for the injury depending on what stage it's in. And keeping the area clean, covered in special dressing are key to care for the pressure ulcer. The article also explains the common areas that they can occur, such as the hips, elbows, buttocks, and more.
Good. All right, so the second article we have, this article talks about the importance of the nurse and prevention of pressure ulcers and care of them. It talks about risk assessment tools and the importance of giving risk assessment within 8 hours of the patient's arrival. I found this article particularly interesting because it had an acronym that I hadn't heard of before for pressure injury care. It's called SSKIN, or SKIN. It stands for surface, skin, keep moving, incontinence, and nutrition. And this is great to remember because it discusses pressure relieving devices, how to assess the skin, how active a person should be, repositioning techniques, the importance of keeping the skin free of moisture, and nutrition related to pressure ulcer healing.
So in this article under section 1, Are We Ready for Change?, there are different statistics related to pressure ulcers, and these statistics are given about the number of people affected, the average cost of pressure ulcers, lawsuits, pain associated with injuries, and their death rate.
Okay, this next one we have, this article describes the staging process of ulcers and what you will be able to see and feel at each stage. A pressure ulcer is determined by the depth and severity of injury, being put on a chart of 1 to 4, 4 being the worst stage. It also explains ways to avoid pressure injuries and the appropriate diet to follow to help prevent them. There's all that.
And so our last article that we found is about a study that was done in Japan to determine whether collagen peptides increased pressure wound healing or if they had no effect. The overall conclusion was that collagen supplements in drinks shorten the wound healing process by enhancing the synthesis of collagen and elastin. They also found that total protein was related to healing of pressure ulcers.
Okay, so I'm going to be talking a little bit about why we are teaching about pressure ulcers and then how to prevent them. Before starting nursing school, I knew little to nothing about pressure ulcers, but it's a topic we discuss quite frequently because there's such a high prevalence of them. And since they can affect so many people, that's why my group thought this would be a good topic for our education project. Our poster goes over the basics of pressure ulcers, so this includes what they are in the different stages. We also discussed risk factors and prevention, the diet and nutrition involved in healing tissue once you've gotten a pressure ulcer, as well as the care of the wound itself. Next, I wanted to expand a little bit on the prevention of pressure ulcers. This is a big takeaway from our project because even though we know how to treat pressure ulcers, the ultimate goal is to stop them from forming at all. Some preventative measures include relieving pressure when you're sitting or lying by using a padding or pillows and to reposition yourself often to prevent applying prolonged pressure on any specific part of your body. Making sure your skin is dry is important as moisture can weaken the skin and make that area more susceptible to a pressure ulcer. It's also good to frequently assess the surfaces of your skin to look out for the beginning of a pressure ulcer. Ulcers are easier to treat the earlier they are caught.
Hey guys, I'm Rachel Dorsky.
And I'm Kayla Hunter.
And we're going to be talking about our group teaching tool.
So for our teaching tool, we decided to make a game-like system to teach patients about the importance of consuming foods with enough protein every day to lower pressure ulcer risk or improve wound healing. Because a low protein intake delays wound healing, we thought it would be important to teach patients how to create high protein meals based off of their weight. We thought that this game would give the patient more control over their nutrition, thus improving patient interaction in their healthcare plan and overall patient autonomy.
The game was made specifically addressing the health literacy and cultural awareness of the different patients who would be interacting with it. Each patient is unique in their experiences and their knowledge level, so our patient teaching tool caters to any patient who interacts with it. For health literacy, we included a photo and the name of the food item. This allows those who may be unable to read to still participate in the teaching process. It is also beneficial for visual learners to see the food items that they can eat. In addition, we included a helpful conversion chart with different weights in both pounds and kilograms, with a conversion to tell a patient how much protein intake he or she needs depending on their stage of pressure ulcer. We included this chart for those who might not be able to understand the conversion process. However, we also included the equation and conversion factors for those who are able to do the math.
For cultural awareness, we added a variety of food options in order to cater to different religions, different cultures, and different dietary needs. Patients should feel comfortable at all times, and they should feel like their healthcare providers are taking all of their needs into consideration in order to provide holistic, patient-centered care. By providing vegetarian, vegan, and gluten-free options, patients with dietary preferences or restrictions, and patients who have specific religious or cultural diets will all be able to build daily meals that will help with the prevention of pressure ulcers.
Next, Julia will be demonstrating how to use this teaching tool in a simulated patient care situation.
So for our patient education game, I decided to teach my sister about pressure ulcers. Ever since the quarantine started, she's been sitting in one spot all day, and all she eats is Fruit Loops, so she's at risk for pressure ulcers and malnutrition. And so, essentially, for our game, you're either in Category A or Category B, and Category A is people like Elizabeth who are at risk for pressure ulcers or malnutrition, and then Category B is patients who already have developed pressure ulcers, and they need a higher daily protein requirement in their diet. So for Category A, like her, the daily protein intake is recommended to be 1.25 grams to 1.5 grams of protein per kilogram per day. And then for Category B, the stage 3 or stage 4 pressure ulcers, the daily protein intake recommendation is 1.5 to 2 grams per kilogram per day. And so to calculate that, Elizabeth is 100 pounds, which is 45.45 kilograms. So 45.45 kilograms times 1.25 is 56.8. And then for the higher end of that range, 45.45 kilograms times 1.5 is 68.2 grams of protein, which is like a daily range for her of around 57 to 69 grams of protein per day. So we're gonna teach you how to do a healthy diet. So since this is your protein intake, your recommended protein intake per day, I want you to come up with a daily diet. So like 3 meals or snacks that meet this protein intake.
Bread. What am I at? 66 left.
And so some foods are gonna have more protein
I
than
only get
others.
to pick 2 more.
No, you can pick as many as you want that meets the protein requirement.
Okay.
So things like pork chop have more protein than like bread. So pork chop has 18 grams of protein, bread only has 2. So maybe like incorporate more protein-rich foods into your diet to prevent pressure ulcers or malnutrition.
I'm at 38 plus 17 is 56. So I got 12 more to go.
38 plus 17 is 55.
Oh yeah. Okay. 13 more to go. Go for the almonds. I have done it.
Nice. Okay. Do you want to read off like how many grams of protein are in each thing?
Sure. Half a cup of almonds has 14 grams of protein. 3 ounces of salmon has 19 grams of protein. Mozzarella cheese, 3 ounces of it has 19 grams of protein. slice of bread has 2 grams, although I would estimate I eat like 3 slices of bread a day, so we can take that to 6. And then a half cup of cheddar cheese is 15 grams.
Yeah, so do you see how easy it is to incorporate protein-rich foods into your diet to
Thank
prevent
you,
pressure
Julia.
ulcers and malnutrition?
Now I won't get a pressure ulcer.
That was our clinical teaching project. If you have any questions, please feel free to ask.